Welcome back, folks. Welcome to HIP, Health Insurance Personalized. Health Insurance Personalized. This is Consumer's Doctor on the behalf of Foremost Organization. Big ideas for consumer-driven care. What are those big ideas? We'll go into detail. What are the big ideas for consumer-driven care, healthcare? So far, all along, consumers have been ignored by our representatives, by the government, by everyone, including the insurance companies. I would say specifically because consumers have been ignored. So what are these big ideas in consumer-driven care? I'll give you one by one. Risk segmentation, number one. This risk segmentation. You have a right to be grouped with others that have similar health risks, folks. Good or bad, it doesn't matter, good or bad. Only then you will be able to get relevant and a timely information, appropriate level of coverage, and proper medical care at an affordable insurance premium, folks, at an affordable insurance premium. Right now, there's no risk segmentation by our insurers. Whatever the reason may be, they refuse to segment us into risk segmentation to well category, at-risk category, chronic illness category, and catastrophic. We need to be grouped into these four risks. As we speak, right now our health coverage is broadly, our insurance is based on general risk pool. They're not segmented. So this is a big idea, folks. Risk segmentation. Consumer has rights for a segmentation of the risk basing on the health, whether good or bad. What is number two? Healthcare consumerism. Healthcare consumerism. You are a healthcare consumer. Sorry. You are a healthcare consumer. Efficient free markets always respond to consumer demands for products, services, and information. Like any other sector, folks, like food industry, retail. But in healthcare, it's not happening, folks. It is time. It is time we tried a system that focuses on the consumer and the patient's needs. It's very important, folks. Healthcare consumerism, number two. Number three, personalized health insurance. Personalized health insurance is a voluntary, hassle-free idea, folks. Hassle-free idea that focuses on the importance of health insurance affordability and choice. Yes, choice. It does not mandate any plan design. Very important. It does not mandate any plan design. With personalized health insurance, premiums could be lowered by 15 to 20%, folks. 15 to 20%. So it's very important. So what is the next big idea? Number four is individual health insurance, folks. Individual health insurance. Affordable individual health insurance should be guaranteed issue, covering pre-existing conditions and help the sickest among us and the most serious impaired health conditions of all. Most serious health conditions of all. That is very important, folks. Individual health insurance should be guaranteed. No questions asked. No questions asked. And number 5, small group health insurance. We have small businesses that are not able to provide health insurance for the small groups, small businesses. Our country is a bread and butter of small businesses having difficulty getting a coverage, health insurance coverage. Allow segmentation. As I talked about, allow segmentation of a small group members into impaired health support plans on application on first renewal. This will lower small group health premiums by at least another, you're talking about 15 to 20%, folks. We need to have a small, and the other thing is small groups can be pulled together. They will be able to join larger employer groups. So smaller groups should be able to get pooled and should have the same benefits as the larger employer. So we need to focus on smaller employer groups, small business, mom and pop stores. This group has been neglected by our representatives in Washington. So that's very critical to have a small group health insurance, folks. What is the next big idea? Number 6, large self-insured groups. Large employers need health care reform more than health insurance because they are self-insured. Most of the large groups are self-insured. They need health care reform, folks. Larger self-insured groups would benefit from transparency of medical service costs. They are self-insured. The transparency plays a big role. Medical quality standards and, very important, tort reform for healthcare professionals. We as healthcare professionals practice defensive medicine. Most of the healthcare professionals, including the hospitals, they practice defensive medicine. That's costing us a nominal. They do unnecessary procedures, unnecessary testing, unnecessary CAT scans, MRIs, because of a liability. So we need to have a tort reform, folks. So larger employer groups mostly need health care rather than health insurance reform, folks. What is the next big idea? Number 7, health review authority. This is so critical. Create a health review authority under the public-private partnership. This doesn't cost a government a penny, folks. This doesn't cost a government a penny. By having a health review authority to provide a fair segmentation of risk and the empowerment of consumers. Empowerment of the consumers initially rejected for health insurance. The people who are rejected or so-called uninsurable, health review authority will address and they will provide certificate of guaranteed coverage. So it is very important, folks. Number 7. What is number 8? The big idea is access to care. Access to care. Establish access to care by first creating better access to affordable health insurance. Whatever you might say, COVID has done something good. Now with telemedicine, telehealth, teleservices, it is going to revolutionize the access to care, folks. We don't need to be waiting in the doctor's office, waiting in the emergency rooms. Those days need to be, they need to be addressed, and access to care through telehealth, telemedicine. So it is very important. So to have the access to care. What is the next big idea? Number 9 is quality. Quality of care is only possible when options to access care is provided through affordable health insurance, folks. Quality of care through affordable health insurance. It is so important to have quality of care. We already have quality, but I think it is not affordable. It has to be affordable. That is, the risk segmentation should lower the premiums. We should have health insurance at an affordable premium, which can provide the quality of care through access and overall care. It has to be through affordable premium. What is the next big idea? Number 10. Next big idea, folks, is cost of care. Cost of care will go down as we know it, because right now with transparency and risk segmentation and overall the cost of, and consumers being in the driver's seat, will lower the cost of care by segmentation of the health status and health risk. We need to have a risk segmentation, folks. We need to be categorized into well category, at-risk category, chronic illness category, and catastrophic category, where focus needs to be on the chronic illness category. That's where most of the cost is going up, because we are not focusing on the chronic illness people. This is where we need to address and bring down the cost. There are group impacts and personal impacts to costs. So group and personal changes in behaviors can lower the use of medical services, folks. Medical services. Lower the cost of care. Lower the cost of care. Reduce the premiums and offset out-of-pocket expenses. That's what we need to do. We need to have that. The cost of care is so critical. What is the next big idea? Number 11. What is the next big idea? Financing the health insurance. How do we finance the health insurance? This is where the personalized health care will address that. Recognize health insurance can be financed through at least 3 different mechanisms under the personalized health care, folks. Number 1 is insurance. Number 2 is savings, so-called taxable, non-taxable health savings accounts, health reimbursement accounts. And number 3, you have to have incentives and reward, folks. In a consumer-driven healthcare, incentives and reward, especially for people who are at risk and who are at the chronic illness category. They need to have, so we can lower their premium. They have to have consumer incentives and rewards, which will lower the care. Ultimate cost of care will be lowered by incentives and rewards. What is the next big idea, folks? Number 12. Well, individual certificate of guaranteed coverage under the Health Review Authority. As long as you have individual certificate of guaranteed coverage, empowers and guarantees everyone individual health insurance, even if they have a pre-existing conditions and or in need of financial assistance, they're guaranteed by the Health Review Authority, which is under the public-private partnership, folks. This is a big idea, folks. Segmenting the uninsurable individuals to the premium subsidized impaired health support plans can lower the premiums by 15 to 20%. Premiums, I'm talking about the premiums, folks. It can be lowered to 15 to 20%. What is number 13? What is the next big idea, folks? 13, small group certificate of guaranteed coverage. small group, using the certificate of guaranteed coverage for the small businesses, smaller groups, along with impaired health segmentation at application and the renewal at the first renewal can lower the group premium by 15 to 20%, folks. 15 to 20%. So we need to have small group certificate of guaranteed coverage. So that was 13 was a big idea, folks. What is 14? Yes, impaired health support plans. Impaired health support plans. Enactment of impaired health support plans will provide a maximum help and support to those most in need, folks, most in need. If every beneficial service, assistance, and plan design options will be available to those with chronic and persistent illnesses. These are the folks we need to focus our attention on. What is number 15? What is the next big idea, folks? Eligibility for impaired health support plans. Eligibility, providing eligibility to both uninsurable individuals and small group members will provide the targeted support and choice of plan options and affordable health insurance for the sickest among us. That's what our focus should be. Eligibility for the impaired health support plans under the Health Review Authority. That was number 15, folks. What is number 16? Options for impaired health support plans. Options for the impaired health support plans provide those needing impaired health support plans with insurance plan options related to the unique needs of this group, folks. Unique need of this group. This is very important under the personalized umbrella of personalized healthcare. What is number 17? Folks, 17. These are those big ideas. Participating insurers who voluntarily participate with Health Review Authority and accept certificate of guaranteed coverage will have a market share and pricing advantages for both individual and small group policy. These are for the insurance companies, folks, who are the participating insurers who voluntarily participate with Health Review Authority, accept certificate of guaranteed coverage, will have a large market share and pricing advantages for both individual and small group policies compared to our not participating insurers. What is the number 18? The big idea is the cost of being voluntarily uninsured. There are 26 million uninsured in this country. There has to be the people who choose not to get the insurance for whatever the reason may be. They think they don't need it. There is a cost for being voluntarily, and people who don't buy the insurance basically lose their tax exemption for individual or family. So there has to be a cost. So loss of federal and state personal tax deductions to these people who voluntarily don't get the insurance, that will help to finance the impaired health support plans, folks. That will help to support the impaired health support plans for those uninsured will be eventually be insured under this umbrella through the loss of tax exemptions will create more revenue for the federal and state governments. So those are the 18 big ideas for the personalized health insurance, folks, so-called consumer-driven healthcare. And the last but not least, what is number 19, the big idea? Funding the Health Review Authority and the Health support plans. Where does the funding come from? This is a big idea, folks. Number 19. Health Review Authority should operate as a self-sufficient entity. It has to be self-sufficient entity deriving funds through multiple membership and processing fees, folks. Multiple membership and processing fees. The impaired health support plans will be supported by commissions, tax deductions, tax deduction losses, charity donations, coupled with state and federal subsidies, folks. State and federal subsidy. What is the next big idea? Number 20. What is the next big idea is to have health insurance covered to all Americans through personalized approach, folks. Personalized needs. Consumers are in charge. Give them the tools. That's the big idea, folks. Give the tools to the consumer. That's number 20. Give the tools to the consumer so that they can have incentives and rewards. They can benefit from the incentives and rewards. And also, by having consumers driven healthcare, it gives incentives for the consumers to be healthy, and they will have to be personally responsible because it's going to cost them. If they don't take care of themselves, it's going to cost them personally. And people who don't buy the insurance, there are consequences, folks. So consumer-driven healthcare through health savings accounts. Every American should have personal care accounts. This is a big idea, folks. Personal care accounts, healthcare accounts. It is through the HSA, contributions are tax deductible and they're tax deferred. So it grows, those funds grow in your personal care account, so where consumers can choose what they want, what they need, and what medication do they need. And also the Medicare also has to embrace these ideas, folks. Right now, Medicare is delegating it to the private insurers. I would like to say has to delegate to the individual senior member, AARP members, so they can handle their own health care and they can buy the healthcare insurance coverage. Let them choose what they want depending on their individual needs. This is the beauty, folks, of having a personalized healthcare, especially for the senior folks. They need to be given control on their healthcare. So-called Medicare Advantage is a disadvantage because people have no idea. Medicare Advantage is a disadvantage because they are giving up their Medicare, their sweat and blood to the private insurers, which is not acceptable. Every individual senior member has to be responsible. They can shop for their own healthcare premium. Give the tools what the senior folks need so they can get their own health insurance rather than taking away their Medicare and giving it to the private insurance companies, which is not acceptable, folks. It's not acceptable. If you have personal care accounts, they can get the dental care. They can get the eye care. They can get the prescription drugs, folks. There are a lot you can do under the personal care accounts. Thank you for listening. If you like this channel, subscribe, share, and hit the notification button, folks. Thank you. God bless you. We will see you in the next episode. Goodbye.